Good afternoon, everyone. My name is Jerome Bailey, and I'm with the ESRD National Coordinating Center. I want to thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the NCC COVID webpage, usually within 3 business days. Many times we will have the recording up on the webpage well before 3 business days. Let's take a look at the agenda for today's call. Today we are pleased to have 2 patient subject matter experts who were a part of our first series of COVID-19 webinar events in 2020. We will be discussing how kidney patient care has changed in the year of COVID-19. The NCC recognizes that talking about experiences during COVID-19 or any sharing of healthcare experiences can be considered protected health information. We want to thank our panel for choosing to share, and we appreciate your interest in the topic. We will introduce everyone in great detail shortly. Our topic for today is COVID-19 year in review, a patient perspective. After their presentations, we will have time for question and answers. This does not mean you have to wait until the end of the presentation to ask your questions. As your questions arise, please submit them using the chat or question feature through WebEx. Our goal is to answer as many questions as time allows. Now, next slide. Before we start our presentation, we wanted to share with you a few new resources added to the NCC website. One is COVID-19, a positive test or under investigation, being prepared. It's a brochure for in-center hemodialysis patients who have been diagnosed with COVID-19 or are considered under investigation. It offers questions to ask your dialysis facility and the cohort facility if you are sent to a cohort facility. There are also suggestions for maintaining your emotional well-being. Visit kidneycovidinfocenter.com and select for patients to download the resource. Next, another new resource we have is the COVID-19 trend maps developed by the ESRD NCC and the Kidney Community Emergency Response Program. The maps show COVID-19 positive case rates among the general population and the ESRD population. Maps are organized by ESRD network service area in color and in black and white. The ESRD NCC encourages you to share these maps with the facilities in your network service area as well as the patients in your community. So next slide, what's this call about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And this series of calls is available to you bi-monthly, offering a variety of topics. Next slide. Let's get to know our 2 panelists. First, we want to welcome back Precious McCowan. Many of you know Precious. She is a 2-time kidney transplant recipient. She was diagnosed with kidney disease in 2010 and received her first kidney transplant, kidney and pancreas transplant that same year. When that kidney failed after 7 months, Precious received in-center hemodialysis for 8 years, during which time she started her patient advocacy journey. Precious received her second kidney transplant in April of 2019, so she just celebrated 2 years. We also want to welcome back Dawn Edwards. Dawn is the CEO of New York State CKD Champions, which is the advocacy and education group she was instrumental in founding. Dawn was diagnosed with kidney disease in 1992 and is currently using home hemodialysis. She had also done in-center hemodialysis, peritoneal dialysis, and short daily home hemodialysis. Dawn's biggest accomplishment was reinventing herself after mastering home hemodialysis, starting New York State CKD Champions, and re-entering the workforce as a home dialysis advocate. So, Precious and Dawn, we are happy to have you both with us today. Welcome back. Let's get the conversation started, okay?
Sure.
All right. So, Dawn, we're going to start with you. We had you on the COVID-19 webinar titled Remaining Connected While Practicing Social Distancing. During that conversation, you talked about how you immediately started worrying about in-center dialysis patients and dealing with the emotional impact of social distancing. What are your thoughts on how those patients fared emotionally?
I'm still concerned as a fellow patient. I know that the dialysis center is like a second home for a lot of our dialysis patients. We look forward to going to treatment, to seeing our friends, to socializing and sharing our experiences, and having to socially distance and not being able to congregate in the waiting rooms and outside like we used to, I'm sure has had a huge emotional impact on a lot of patients. I know that a lot of patients that I've spoken with have felt isolated for having to shelter in and, not being able to have their meetings in facilities as they used to, and not being able to do a lot of our educational events like we used to. So I've steadily been concerned, but I know that there have been so many other ways that we have reinvented ways of socializing during this crisis, like forums like this, for example, where we can all come together and learn and share, and the other platforms like Zoom, where we've been able to have some type of support group meetings and things. So I am hoping and I'm thinking that a lot of patients are just really hanging in there until, we can get back to the things that we are used to doing and that we love so much, and that's being close to one another and being able to really share our experiences and bond like we used to. Um, Getting our vaccinations has been a huge success, and I hope that that all of our patients are taking advantage of those opportunities to get vaccinated so that we can hopefully go back to normal as our country starts to reopen.
And have a lot of patients that are part of your CKD Champions group, are they getting vaccinated?
We have been talking about vaccinations before the vaccinations even were FDA approved, and stressing the importance of getting vaccinated. A lot of the CKD champions that we have been communicating with have been proud to post that they have gotten vaccinated, as well as the patients that are in my geographic area that I've been in contact with. So it really looks like everybody is looking forward to getting our lives back and getting vaccinated, so that we can protect ourselves and protect the people that we care about and love.
Okay. Now, going back to when we had you on the original COVID webinar event last year, during that conversation, we talked about connecting with other patients in person. Can you talk about how, other ways you were able to connect with other patients? I know you mentioned Zoom. What are some of the other ways you were able to connect with patients?
Well, with CKD Champions specifically, we're a Facebook group, so we never stopped communicating with each other. We were very careful to make sure that we posted um, uh, information that was going to be helpful to fellow patients during the time of the lockdown, you know, information from the CDC, the NCC, the ESRD networks. We wanted to make sure that we gave them good information so that they can continue to keep themselves safe, information about diets. We checked on patients who were regular posters, and we put out posts asking everyone to please check in and let us know how you're doing, how you're coping, how you're managing. And we also wanted to make sure that we posted information where they could stay connected. Information when the NCC was having webinars or our local ESRD networks so that they could connect to that information and that they could stay active while they were sheltering in. So I think that we did a good job as far as CKD champions, and I also think that our other kidney organizations, they really did a good job at trying to keep patients connected. The 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 concern that I have is with patients who aren't technologically savvy, who don't have the internet access, and who we weren't able to, you know, get out there and reach. As you know, in New York, we had a really stiff lockdown because we were so heavily impacted by the virus. So we weren't really able to go out and visit or anything like we used to. So I'm really looking forward to getting back to getting out now that I've gotten my vaccines and things are getting better. I'm looking forward to getting out and seeing some of the patients that I didn't have the opportunity to connect with on these online resources.
Okay. Thank you, Dawn. And Precious, I'm going to basically ask you the same question. How did you stay connected to family, friends, organizations you were involved in? And how do you think that helped you over the last year?
Well, so I did. I stayed connected with family and friends via phone and Zoom. You know, since our Zoom calls were scheduled and pretty much my entire family was invited to join and people did attend, I really think that my family and I actually grew closer, you know, communicating and connecting through Zoom during the pandemic. You know, we tried to keep our calls very creative and engaging. So we played games during our calls. We had like sing-offs, and we even had calls where we would have deep and serious talks about concerns and challenges within the family. So I also stay connected by Zoom, WebEx, and GoToMeetings with my kidney organizations and other health organizations that I am a part of. So with that, you know, we had these frequent calls, and at the beginning, you know, I appreciated the connection, and as always, our calls are very interactive and engaging. However, I don't know about anyone else, but to speak honestly and candidly, I became burnt out. I really did. I became burnt out with the whole Zoom and WebEx ordeal. So I had to make sure that I found a balance to attend to my mental state, despite all of the technology that was being used during COVID-19. But, you know, that can be challenging for someone like myself and Dawn, for individuals that are basically on a mission to implement improvement within the healthcare system. But overall, technology has helped me to be more involved and to be connected to others. So that's how I stay connected.
Yeah. You know, I heard a lot of patients or people in general, friends, myself, talk about how they grew closer to family during that time because you were able, I guess you felt led to communicate more with them, and you had to be creative in your communications with them. So I see that across the board, that family connection for a lot of us. Precious, you appeared on our COVID-19 webinar event titled Preparing for a Kidney Transplant During COVID-19, where you shared tips on how patients can prepare for transplant. One of the things that you talked about being disappointed in is during that call was the ability to review your lab results with your care team. You were not able to do that anymore. Has that changed?
So yes, and I'll talk about it a little bit. So at the beginning of the pandemic, my transplant center requested for more stable patients to get their labs drawn at their local LabCorp. So with this process, I had to wait several days for LabCorp to send my results to my transplant center, and then I had to wait an additional day for my results to be posted to my patient portal for me to review. So before the pandemic, I had access to my labs within 45 minutes. And if I had a scheduled appointment to see my doctor that day, I had the opportunity to go over my lab results with my transplant physician, and they were able to make recommendations or changes right away instead of waiting for, the results from LabCorp. So this issue did change for me because I expressed my concerns to my transplant team about my unique medical situation and my anxieties about not having access to my lab results within like 24 hours. So my transplant team, they agreed and they listened to me. So I was grateful for that. And I was able to come into the clinic to have my labs drawn and receive speedy results. So I really appreciate the connection that I have with other advocates. I remember it was a KPAC, the KPAC group that I'm part of, also with Dunn. We were having a brief discussion about, the new direction of healthcare and the use of telemedicine during the pandemic. And I remember voicing my concerns about, my delayed lab results. And one of the members, I believe Stephanie Dixon, to be exact, she told me, she's like, you have the right to request to be seen in the clinic despite of the pandemic. So I basically took that information and I used it to my advantage to be seen in the clinic. So yeah.
Okay.
It did change.
Again, patients learning from one another. Don, over the last year, we've seen a lot of people start to use telemedicine instead of in-person visits with their healthcare team. Is this a tool you use with your healthcare team? Do you see yourself continuing to use it? What are some of the challenges to using telemedicine?
Yeah, absolutely, Jerome. Telemedicine was a blessing to me because as a home dialysis patient, I was really concerned about going out and having my clinic visits and appointments with my care team in the dialysis facility. That was not someplace that I wanted to go. I was really working hard at staying inside and not going out at all. I had groceries and everything delivered, so I did not want to go out to my clinic visits. And thank goodness my facility was really expedient in turning things over and switching into telehealth. So I was able to have my clinic visits right from the comfort of my bedroom. And my lab results were ready when at my appointment time, so that I could go over all of my lab results with my care team. And it wasn't only with my dialysis related appointments, but my other health appointments I was able to do via telehealth as well. So at the height of the pandemic, when everyone was sheltering in, I was still able to have my visits with the key members of my healthcare team, outside of my kidney care, which was really really great for me. And I'm looking forward to continuing to do that. Um, I do appreciate being able now to go back, to seeing my care team in person, just because I miss them, and it's good to have that face-to-face meeting when necessary. But it is good to know that if I don't want to go out or I don't need to go out, that we can all connect together and discuss my healthcare and important issues that are affecting me, right in one place. And I think that it's really essential for patients to know that our members of our care team are accessible to us through telemedicine. And I think that it was a huge advantage for us to be able to stay indoors and stay safe, while still addressing our important health needs.
Uh, what were the challenges, if any, did you face using telemedicine? Uh,
Um, Initially, some of the challenges were I didn't feel like I was being appropriately assessed, maybe because they couldn't see me. But as we got into discussions and questions were asked by the members of my healthcare team, I kind of relaxed from that a little bit because I initially felt like, oh, I can't possibly be getting good health care while I'm looking at them through a Zoom screen. But by them asking the same questions that they asked me, when I had my clinic visit, and them taking the time to ask me what questions did I have and address all of my issues, I was quickly able to overcome, that little aversion that I had with doing the telehealth visits, because I initially wasn't into doing the telehealth. I was happy to be able to do it at home, but I didn't think that I was going to be able to get the same quality of my clinical visits. But I was quickly able to overcome that challenge.
yeah. And you, Precious, any challenges for you when telemedicine was first introduced to you as an option?
Yes, there were challenges, and I used telemedicine as a tool for my health care. I used telemedicine, kind of like as Don stated, to meet with each of my physicians in the thick of the pandemic, except for my endocrinologist, who is more hands-on, which I greatly appreciate, and for my annual visits to see my gynecologist. I believe that I would continue to use telemedicine for particular instances, such as for like a medical consult or a follow-up from a previous appointment that was done in person. And of course, there are pros and cons to using telemedicine, but I like that doing the telemedicine visits that my physicians spent more time explaining their recommendations and answering my questions. With the telemedicine visits, I actually noticed the, improvement in shared decision making and patient-centered care. I also believe that the relationship with my care team is much stronger. However, I strongly believe that, patients like myself with chronic conditions should also be seen in person more than, being seen over a telemedicine visit. Sometimes it's helpful to have your physician to physically examine you. Sometimes a physical exam can alert the physician about unforeseen health problems that may arise in the future. And to answer, you know, the last part of the questions of challenges, I kind of answered that. My challenge was, you know, not being able to be seen. Sometimes, you know, I may feel like I have fluid, excess fluid in my body, and it's good for that physician to do that physical exam, to listen to my lungs, besides looking at me directly through a screen and saying, oh, you look fine today, when really and truly there's something else that could be cooking up inside that can cause an issue later on.
Okay. Now, you guys are in the know. You both are involved in the community a lot. What were other patients saying about telemedicine?
Well, for me, a lot of patients were talking about the difficulties that they were having because of technology. Here in New York, I mean, you would think that it's the information capital of the world, you know, that everybody has a smartphone. You know, we take these things for granted, but everyone is not technologically savvy. And, you know, particularly our older patients or patients with language barriers, they specifically face some challenges with learning how to use these different platforms and getting connected and having a Wi-Fi signal, and you know, having the time and a nice quiet place to discuss private health matters and things of that nature. So there were some real challenges out in our community that are still going on today. You know, we still have people that do not have, you know, internet connections or Wi-Fi signals that are able to utilize these things that we so fortunately take for granted.
Absolutely. Okay. And Dawn, she spoke about some very valid concerns and issues within telemedicine. And since she spoke about that, from my perspective, I guess like on the plus side of telemedicine, I noticed that patients that were stable in their health and younger, they really appreciate telemedicine visits. They've expressed that this option, it frees up time in their busy schedules, and that they are more willing to go to their appointments instead of, you know, canceling them because of transportation issues or because they're just not feeling well that day. So they were more receptive of attending their appointments because of telemedicine. They have also expressed that with the telemedicine option, that they are able to set multiple medical appointments within the same day. So as we all know, there's a plus side and there's a downside to the use of telemedicine. And I'm hopeful that these barriers will improve over time.
Thank you. Thank you both. Can you share how the COVID-19 pandemic has shaped your kidney care in other ways? Let's start with you, Precious.
Okay, of course. So we all know that the pandemic, it shook this country in various ways. So as far as shaping my kidney health, I can say that since the pandemic and the approval of telemedicine, I have established a stronger relationship with my care team. And because of this stronger connection, I feel that my care team and I are more receptive to each other's recommendations for my care. I think because of this, we're kind of all on the same page. They understand my views for my recommendations, and I understand them. And so, you know, we're basically working together more as a team. But, you know, this all came about because of telemedicine and the time allowed during those visits for my care team and I to work together for better healthcare outcomes for me, for planning these better healthcare outcomes, for planning and working together. So that's how the pandemic has basically shaped my my kidney care.
And it's
Don?
funny because it was quite the opposite for me during the pandemic. I had a health crisis, and I had to be hospitalized, and I was afraid. I was really afraid to have to stay in the hospital and then have surgery and then follow up with a rehabilitation center visit, and it shook me to the core during a time like that when everyone is sheltering in and staying at home. The last place that you want to be is staying in a nursing home. And so my healthcare, in the middle of that crisis, I was disappointed by the care that I received. I was hoping for a little bit more than I got. And so, in the midst of that crisis, I had to put my advocacy hat on and advocate for myself. And I had to change providers completely in order to get what I felt that I deserved. And looking back on it now, I think that empowered me even more to do the work that I do in educating and helping patients to be empowered and standing up for themselves and advocating for themselves. And I think that the new care team that I have now, they are aware of who I am and what I expect, and I think that we have a wonderful relationship because they saw that in the midst of a crisis, I sought out better care because I knew that that's what I deserved and that's what I needed at the time. So I think that overall, my healthcare experience has greatly improved as a result of a crisis.
Wow.
Just
Good for
smiling
you.
inside. Good, Don. I'm just smiling inside because I remember that difficult journey for you, and I had no idea that you had to switch providers and go through that. But kudos to you for advocating for yourself.
Thank you. It wasn't easy. But looking
So,
back on it, I'm sorry, Jerome. Yeah,
go ahead, finish.
looking back on that now, when we tell patients to advocate for themselves and we encourage patients to speak up and call your ESRD network if you're not satisfied with your care. We really have to do those things. And me having to do it for myself was it was a feather in my own cap. It made me feel good about myself, and also about the information and the resources that are available to us now. You don't have to accept anything. There's always help out there.
Absolutely.
Has the pandemic changed how you think of emergency preparedness? Like, I've worked with both of you on the kidney community emergency preparedness team. So has the pandemic changed how you think of emergency preparedness?
I know that it absolutely has for me. Being a home patient, I've always been aware of emergency preparedness. I did PD at home for 10 years, and now I'm doing home hemo, at home for 10 years. So it's always been important to me. But when you think about hurricanes and snowstorms and natural disasters and things like that, but pandemic was something that we just never, I, I couldn't have foreseen what we experienced over the last year. So it's made me look at things a lot differently in reference to small things that we thought we took for granted, like ordering my groceries. at the height of the pandemic, or when things first started to shut down here in New York, I was unable to get groceries. And so it made me think about a lot of things differently in reference to how I organize my finances, how I shop for food, even small things about my dialysis supplies. And just it made me think of everything under a more fine-tooth comb than I did before, because pandemic just wasn't in my prospectus as things to be worried about. But now I think that I'm much better prepared as a result.
Absolutely. And I just have to piggyback off what John said, and I agree with it all. We had no idea when we first heard about COVID-19 that it would affect us to this degree. So, and to add to that, the pandemic has absolutely changed how I think about emergency preparedness. Even before the pandemic, my immediate household has always had a plan in place if a natural disaster was to occur. Living in Texas, there's always this fear about tornadoes, known as the Texas Twister. So we've always had a plan for that. But since the pandemic and its uncertainties, my family that lives in the same city as me, we have come up with a universal system as to what to do if someone in the household gets COVID and does not have to be hospitalized. We've come up with this plan as to how we isolate the other family members while also making sure that the family member that's affected with COVID is still getting their necessities and still being, checked on and attended to. So also, most importantly, for emergency prep, during the pandemic, I took advantage when some insurance companies were allowing for patients to fill extra month supplies of medication, because they were in fear of not knowing how the pandemic would affect the pharmaceutical industry. So if a pandemic or a disaster was to surge, I would at least have access to my immunosuppressant drugs and my insulin. So that's how I've prepared, and it has taught me to stay prepared.
Yeah, that's pretty cool that your entire family got together to develop a plan for all of you.
And it was developed over Zoom.
Okay. As the COVID-19 pandemic continues to evolve, what suggestions do you have for helping patients to continue to be empowered and take more control of their health and life?
I have to say that the best way to empower yourself during this particular emergency situation is to get vaccinated. I was so thankful when my mother and I were able to get our vaccines. We got both of our vaccines, and we waited our 2 weeks, and we didn't notice any reaction, or we didn't have any complications. And we've been talking to others about the importance of getting that vaccine. Having antibodies in your body to protect you from this virus, and to keep you from hopefully being hospitalized and lessening your chances of death. I don't think you can be more empowered than that. And that's my answer.
That's a good answer, Dawn. And for me, I would basically tell my patient counterparts to, with all of this going on, pay close attention to changing signs and symptoms within your body,
Mhm.
and be sure to communicate these changes to your healthcare team. Also, be involved with your care. You know, ask questions, address your concerns, and to remember the phrase that I always carry with me and express to my my mentees, the phrase of "nothing about me without me." So that's my advice about being empowered.
All right.
Great.
And our last question before we go to our audience for their questions. What are your hopes and fears for the future concerning your kidney journey and the COVID-19 pandemic? Let's start with Precious.
Yeah, the pandemic has frightened us all, but my hope is that more people across the nation are educated about kidney disease and that they understand the importance of being screened for early detection and prevention. And I hope that I can continue to be an effective advocate to improve this process. I also hope that one day COVID-19 is completely diminished, that we don't have to worry about this anymore. But, speaking on a sensitive note, my fear is becoming a victim of COVID-19 and not receiving sufficient health care because, especially because I have not received the COVID vaccine for various reasons. Not to say that I will never get vaccinated, but for now, I have decided not to get vaccinated, and I have talked to my healthcare team about this decision, and I do appreciate that they do understand my concerns. So that is one of my fears, but since I'm not vaccinated, I do believe that it is very important that I continue to do my part and keep myself and my family safe. My family is vaccinated, but not me. So that is my fear, is basically being a victim of COVID-19.
I would say that my hopes is that we learned from this experience. We have had over a year and a half of separation from one another, changes to our lifestyle, changes to our environment, changes in our socioeconomic structure, and things that have happened within our country, like politically, financially, just on every level, we've been affected. And my hope is that we have all learned and that the light has been shined on a lot of the disparities and a lot of the gaps in healthcare, and that exposure has been put on a lot of things that we didn't feel that it was politically correct or that it was nice to talk about. And so my hope is that that we're able to talk about some of these things now, and that we're able to make necessary changes and make improvements. When the wall breaks down, you build it back better and stronger than it was before. So that's what my hope is for us as a kidney community, us as a nation, and us as a world. I hope that we're able to all come together on one accord and rebuild in a way that we can be better and stronger than before. My fear is that there are those who haven't learned a thing, who have regressed as a result of this crisis, who haven't seen it for what it really is, which is a sign for us to wake up and pay attention. And my fear is those people who haven't learned will hold us back from moving forward. So I just really I'm excited about the possibilities that we can have going forward, and I am concerned that those who didn't get it, perhaps they will never get it.
Okay. Well, ladies, thank you very much for this great conversation. We hope to continue it. We now want to hear our questions from the audience. If you haven't already done so, submit any questions you have for our panelists using the chat feature on WebEx. We did get some questions beforehand, so I'm going to ask you one of those. The question is, can you talk a little bit more about some of the fears you faced during the pandemic? How did you overcome them? What helped you to overcome them?
Well, for me, my biggest fear was catching that virus as a kidney patient, as a dialysis patient. I heard and I saw, people in my life disappear, and I was afraid of, being one of them. And one of the things that I did that was really helpful to me was that I participated in my network's support group calls, and I was able to share those feelings with other patients, and they were afraid of the same thing that I was afraid of. So it made me more resilient, because I felt like I needed to be strong for the other patients and be strong for who I represented. So I was able to dig deep. Like I had to dig down back into those days when I first started on dialysis and find that strength and that courage and bring that back to the surface for me to be able to cope with all of these huge changes that were taking place in my life. I was really afraid at the beginning when we needed food and toilet paper and paper towels and all of these necessities that we needed in the house, and I just couldn't get it, and I was the one who shopped for the household and everything. And when I didn't have access to those things, and I discovered that it wasn't available in my neighborhood, I was really afraid. But as time progressed and I started to network with other people, so my sister had a couple of rolls of toilet paper, and somebody else had a can of Lysol, and I had plenty of masks and soap because I'm a home patient. So we traded off, and and we were able to work those things out so that we could make it through until we were able to purchase the things that we needed.
Absolutely. And for me, it's basically the same thing. Like I expressed before, my biggest fear was, contracting COVID-19 and then, possibly passing it on to family members, not being able to maybe get the right health care that I need, or getting COVID-19 and having to go to the hospital, and the fear of maybe being turned away, sent home to just deal with it alone. So that was like my biggest fear during this whole pandemic. And like Dunn, I was in fear of not having enough necessities for my household, because I am also the individual that shops for those things. So it was like a scavenger hunt. And then in the same sense, I'm worried about, okay, I'm going from store to store to store. I'm putting myself at greater risk for contracting COVID-19. So on top of that, I had anxieties about just having to get out and leave the house, and then not being able to find what I needed. So, yeah, Dunn really explained it all. That was my biggest fear during this time, was getting COVID-19.
So another question we received, what advice would you give others who are still struggling because of the impact of COVID-19 has had on their lives?
Well, I would say that we are so much stronger than we think. It's been a year and a half that we've been dealing, with this pandemic, and no, it's not over yet. But I say this by looking at the glass half full rather than half empty. I strongly believe we're closer to the end than we are to the beginning. And the same strength that you have used to get you through this year and a half to keep yourself safe, you have to use those same measures to keep yourself and your family safe. Reach out. Don't sit and worry and stew in worrying about what's going to happen this month or next month. You know, be proactive, talk about things, reach out to other people, and and don't suffer in silence. And if you need help, reach out for that help, because mental health is particularly important during this time. And I was happy that I had a therapist that I was able to reach out to when I needed to during this. And there's no shame in that game.
Absolutely. And I've learned over time it's important to, empower yourself. Come up with those positive affirmations of, I'm empowered, I am strong, I can do it, I'm the best. Whatever you have to say to motivate and empower yourself to help you through challenging times, I believe that that's important. And one important thing that Dawn just mentioned is mental health is serious. When you have an unhealthy mental health state, it's hard to care for yourself and others that are dependent on you. So at times you may need to talk to someone. I know I needed to talk to someone. I was in a depressed phase, and I didn't even recognize that I was depressed or grieving or whatever you want to call it. I just had to reach out and speak to someone, whether that's a professional, whether that's a mentor or someone else within your community or one of your fellow patient advocates. Please reach out and talk to someone. It always seems to help for me, but the main thing is to, from time to time, you have to empower yourself.
And did television news or news on social media consume a lot of your time during the pandemic? Do those things consume a lot of your time now? Have they been helpful or harmful?
I have to say, television and social media and all of that, that's what put me into the anxiety attack. I just was overloading. Everything that you saw was pandemic and death and sickness. And I was so sick of looking at that picture of that little ugly virus and it was just it was just too much for me. And so I really like I said, I spoke to my therapist and I talked to my friends, and we all said the same thing. You have to tune out from some of those things. You can get sensory overload, and so you have to turn some of that stuff off and turn on something that makes you happy, something that makes you feel good. So I'm a jazz lover. I had to turn on my jazz and put to some of the things that really made me feel good and made me feel secure. And as for right now, I keep um all of that extra sensory perceptions and all of that, I keep all of that to a minimum. I always try to find time, make sure that I'm doing the things that I have to do, but make time to do some of the things that I want to do.
Absolutely. And I did. I had to tune out the news. It's like I wanted to be informed to know what was going on, not only around the world, but within my community. But at the same time, I was becoming overloaded, and it was beginning to depress me. And not even just COVID, just some of the things that was taking place across this country. Amen. So I had to just, shut it off. I like the fact that I did have an outlet like I spoke earlier, you know, with all the WebEx calls, Zoom meetings, I was busy, so I really didn't have a lot of time to watch television anyway. So that was helpful. But yeah, television, the media, the news, oh gosh, it was a big turnoff during that time. So.
Yeah. Well, ladies, thank you very much for being with us today. We really appreciate the candid conversation, your thoughts, sharing your experiences over the last year. Thank you so much.
Thank you so much for inviting me.
Thank you.
All right. All right, so now we'd like to share a few resources we have on the ESRD NCC website. The first one is the tips to help you boost your physical and mental well-being during the COVID-19 pandemic. This was developed by patients, for patients. Actually, Precious and Dawn had a hand in the creation of this. It offers practical tips to help you better deal with stress and anxiety. You can download this resource at kidneycovidinfocenter.com. Just click on For Patients. The next resource we have is the Quality Assessment and Performance Meeting resource. It's a tool to help you prepare for QAPI meetings. Learn what to expect and how to prepare before and during and after the meeting. To download this resource, it's on our ESRDNCC.org/patients website. Again, select for new dialysis patients, and then you'll find the resource under being involved in your care, in the being involved in your care heading. All right. So next, our final resource is we want to remind everyone about the kidneyhub.org. It's a mobile-friendly web app developed by the NCC with lots of input from our patient subject matter experts. It has information on home dialysis, the kidney transplant process, infection prevention, mental health, and more. A diet and nutrition section was added. Check it out today at thekidneyhub.org. And we would like to invite you to mark your calendars for the next COVID-19 webinar event. The provider focus event is on Wednesday, May 19th at 3 p.m. Eastern Time. And the patient focus event will be May 25th at 4 p.m. Eastern Time. Visit kidneycovidinfocenter.com for information and to register. So thank you all again for being with us this afternoon. For additional COVID-19 resources, visit the CASER Coalition website at casercoalition.com or, again, the kidneycovidinfocenter.com for more information. Thanks, everybody. Glad to have you with us this afternoon. Bye-bye.